This is Stacy Lerner. This is my clinical case presentation 2. An 11-year-old female came into our clinic. She was Caucasian. It was in Chicago, Illinois. HMO insurance. I've been coughing for a while and feel stuffy. 11-year-old female presented with a cough for the past 2 weeks. Sometimes she complains that her cough is wet and sometimes dry. Patient definitely feels congested. She denies shortness of breath and fever, no vomiting or nausea, denies diarrhea, denies abdominal pain, and reports that all family members are sick at this time. The abnormal outcomes are in red. She does report a productive cough and reports that she is congested. She has a history of anxiety. So past medical history, anxiety, keratosis pilaris. Her surgical history is unremarkable. No known allergies and no current medications. Her immunizations are all up to date. She did have a flu vaccine this past season and has started on the HPV series. No smoking in the household, no family history of drug abuse or alcoholism. She's going into the 5th grade. She lives with her parents and older sister. No pets. Her sister has an IEP. Her maternal grandmother has type 2 diabetes, and maternal grandfather has hypercholesteremia, hypertension, and prostate cancer. Here are her vital signs. So an abnormal finding that I did take note was I did hear crackles in her right middle field. Everything else checked out normal. So some lab tests. I did take a rapid strep that was done in the office, but it did come out negative. So we did send a strep culture to the lab. Bacterial pneumonia was a differential diagnosis. Viral pneumonia. So we went with bacterial pneumonia for a diagnosis, and the plan was to keep the patient hydrated. We talked about importance of deep breathing and staying active to get rid of secretions and preventing worsening pneumonia. Discussed humidifier in room and taking steam showers. Patient will return to clinic if symptoms persist. Mother appears to understand the course of treatment and agrees with the plan. So we started her on amoxicillin 400 milligrams per 5 ml suspension. We wanted her to give 12.5 mils by mouth 2 times daily for 10 days. So what is pneumonia? It affects the alveoli and interferes with oxygen delivery. So it sometimes makes it harder to breathe. So symptoms are cough, trouble breathing, rapid breathing, shortness of breath, nasal flaring, chest retraction, and grunting. These are especially in children. So how do we diagnose? We diagnose based on the symptoms, the assessment, do they look like they're having trouble breathing? Vital signs, how is their oxygen level? And radiograph X-ray findings. So prevention, the pneumococcal vaccine, influenza vaccine, good hygiene, so hand washing and disinfectants. And here's my reference. Thank you for listening.